Management of thalassemia. The management of thalassemia aims to alleviate symptoms, prevent complications, and improve the quality of life for individuals with the condition. The specific management approach may vary based on the type and severity of thalassemia. So, it's important for individuals to consult with their healthcare provider for personalized advice. Some common aspects of thalassemia management includes regular medical care. Individuals with thalassemia should receive ongoing medical care from healthcare professionals experienced in managing the condition. Regular checkups, monitoring of blood counts, and assessment of iron overloads are essential. Blood transfusions. People with moderate to severe thalassemia often require regular blood transfusions to maintain adequate hemoglobin levels. Transfusions help to improve anemia symptoms and prevent complications associated with low oxygen levels. Iron chelation therapy. Frequent blood transfusions can lead to iron overload in the body, which can be damaging to organs. Iron chelation therapy is used to remove excess iron from the body and prevent complications like heart disease, liver damage, and hormonal imbalances. Folic acid or folate supplementation is often prescribed to individuals with thalassemia as they have an increased need for this vitamin. Folic acid supports the production of healthy red blood cells. Vaccinations. Thalassemia patients should receive routine vaccinations to protect against infections, especially those that could be particularly harmful to individuals with weakened immune systems. Bone marrow transplant. For some individuals with severe thalassemia, a bone marrow transplant or hematopoietic stem cell transplantation may be a potential curative treatment option. The success and eligibility for this procedure depend on various factors and need to be evaluated on a case-by-case basis. Emotional and psychological support. Living with a chronic condition like thalassemia can have emotional and psychological effects. Support groups, counseling, and other psychosocial intervention can provide individuals and their families with coping strategies and emotional support. It is important for individuals with thalassemia to maintain good overall health through a balanced diet, regular exercise, and avoidance of factors that can worsen symptoms or complications, such as iron-rich foods and certain medications. The management plan should be tailored to each person's specific needs, and close collaboration with healthcare professionals specializing in thalassemia is crucial to ensure optimal care.